Paraphilias. A 20-year-old man was caught outside his neighbor's window looking in as she disrobed. Before his arrest, he would wander the subway station and rub himself against women, as well as expose himself to women who were nearby. All of these activities produce great pleasure in the patient. What you have here is a patient who has not one paraphilia, but various paraphilias. And paraphilias are disorders which tend to be recurrent and they tend to be sexually arousing. And they usually involve one or two or three themes. And these themes involve anything having to do with humiliation or suffering, such as sadism, masochism, anything involving non-living objects, such as necrophilia, such as fetish, or anything involving a non-consenting partner, such as exhibitionist, such as voyeurism. So this is typical of all of the paraphilias. They've been occurring for more than 6 months. They are distressing and will cause significant impairment in the level of functioning, which means these are patients who spend most of the day, if not all of their day, engaging in this type of behavior. And until they reach completion of these acts, they will not be satisfied. You see this more in men than in women, and it's usually younger men, typically between the ages of 15 to 25. And of course, it's normal to have anywhere from 3 to 4 to 5 paraphilias. But as the men get older, then the frequency, of course, will decrease. The sexual activity tends to be very ritualistic, the fantasy is always fixed, and there's always the intense urge to carry out the fantasy. Now, the treatment of choice for paraphilias will be consisting of various things. For example, individual psychotherapy would be essential, behavioral therapy could be used for the treatment of some of these paraphilias, and even medications such as anti-androgen medications could be used to reduce the libido of these individuals so they do not engage in these type of activities. The differential diagnosis here is making sure that these are not patients who are simply experimenting with these type of behaviors and not that they have real paraphilias. A paraphilia is where you exclude everything else. So this is the only thing that gives you pleasure, this is the only thing that makes you happy, and you exclude every other kind of sexual activity. There are numerous types of paraphilias. Exhibitionism is the urge to expose yourself. So this is the flasher. This is the person who walks around in a trench coat. When he sees a woman walking by, he opens up his trench coat, and of course he exposes himself and the woman runs away in disgust. This is a type of paraphilia. The second type is fetish. This is the use of non-living objects. So these are patients who have the sexual attraction to a shoe, to a pantyhose, and it has to be there in the act. If it is not there, then these patients, of course, will not get any pleasure out of this. The frotteur is the person who rubs up against you. Subway stations, bus depots, anywhere where there's a lot of people, they rub up against you, and within seconds, that individual will ejaculate. The pedophilia, unfortunately, is the most common of all the paraphilias, and this usually involves prepubescent children. So therefore, the victim is usually under the age of 13, whereas the perpetrator is usually over the age of 16. The voyeur, or voyeurism, is that individual that stands outside your window looking in as you disrobe or engage in any kind of sexual activity. This is the first paraphilia to probably develop. Masochism is that individual that likes to receive pain and or be humiliated, whereas the sadist is the one that likes to inflict the pain and or humiliate the individual. The transvestite fetishism is important because here they make clear distinctions of several things. This is typically a heterosexual male who knows he's a male, so therefore his gender identity is male, who prefers to be with women but likes to wear women's clothing for sexual pleasure. This is not your classic drag queen that you see in shows. The classic drag queen is a homosexual man who wears women's clothing because he's a performer. The transvestite, for the psychiatric definition, will be a heterosexual male with a male gender identity who prefers women's clothing for sexual pleasure.